Hi. So today we will talk about the procedure of urinary catheterization. Uh, in fact, catheterization of a male is a somewhat complicated procedure because male urethra is a bit complex. Therefore, it's always advisable that an experienced person only should catheterize a male urethra. So indications for urinary catheterization are different. It may be for acute or chronic retention of urine, or sometimes it may be as a sort of we want to monitor the input and output very closely in critically injured patients, critically ill patients, and also post-operatively sometimes we make the patient catheterize for monitoring. At the same time, so we have to make sure that all the necessary equipment are ready before catheterization. So if I show you, make sure that some antiseptic solution is there, and sterile gauze swabs, and draping sterile, and also kidney tray might be useful, and sterile gloves, and some catheters, Foley catheters. So we use for an adult male usually 14 gauge or 16 gauge French gauge urinary catheters. They are usually two-way catheters. And three-way catheters we use for other purposes like bladder irrigation and monitoring. And in addition to that, there should be a sterile URI bag, and also some sterile lubricant gel, and also sterile water for injection, and a syringe filled with sterile water to inflate the bulb. So if we start the procedure, first thing is to wash your hands. So a sterile hand washing technique should be done, followed by wearing the gloves in a sterile manner. After that, we will use the sterile drape to close the rest of the area, exposing only the necessary area, which is the penis. After that, the cleaning of the penis. In case of a female, of course, we have to use at least 5 swabs with antiseptic solutions. One for the right side labia majora, and the other one for the left side labia majora, and another 2 for the labia minora on either sides, and 1 for the urethral meatus. So, but in case of a male, we will use something antiseptic solution like betadine, povidone or chlorhexidine, and I will use another gauze swab to hold the penis from the dorsal side. In case of foreskin is there, you will have to retract the foreskin before cleaning. And so we will clean from the center going to the periphery. So beginning at the center, going to the periphery, while you are holding with the non-dominant left hand. So after cleaning the glands of the penis, next step is to anesthetize using a lubricant jelly. So can we have the jelly please? So with the nozzle, you can infiltrate the lignocaine jelly into the penis, and once you instill the jelly, it's better to keep at least 3 to 5 minutes for it to get a bit anesthetized. So in time, I will get the necessary catheter, suitable catheter. So shall we have the 16 gauge catheter please? Okay, right. So I have the catheter in my hand. I have exposed only the tip. And sister, can you keep the kidney tray here? Yeah, thank you. Right. So after anesthetizing the urethra, can you put some jelly? Use some lubricant jelly to the tip. And advance the catheter through the urethral meatus while withdrawing the bag. And in a male penis, you will have to insert at least 15 to 25 centimeters, and at the end of the insertion you will feel some resistance, then you will go into the bladder. Then you will see some water coming if you are in the bladder. So it's better to insert the catheter as much as possible until you see some water coming through. So if you don't see some water, you can use some pressure from the top so that you will see that water is coming through. So in this mannequin, of course, you can't see that. So, but in a real situation, you make sure that you see some urine coming through the nostril here. So after that, we have to instill some sterile water. About 10 milliliters is enough. And although the catheter mentions 30 ml, you don't have to insert 30 ml, which will cause discomfort to the patient and some periurethral leak as well. So 10 milliliters is enough to keep the catheter in place. Mister, can I have some sterile water, please? Yeah, you can see some water coming through here now. And I will inject 10 ml of sterile water to the balloon. And after that, you withdraw the catheter a bit and see the resistance. See the resistance. That means the bulb of the catheter is lying at the base of the bladder. And once you do that, can I have the bag, please? You have to connect the sterile URI bag to the catheter. Sister, can you do this? Okay. Yeah, connect it properly. And when you do that, after that, make sure that you retract replace the foreskin which you have retracted already. Otherwise, the patient will get paraphimosis later. That's a very important step. And after that, keep the urine bag underneath. And you can actually anchor this one. If it is a mobile patient, you can anchor the urine bag to the medial aspect of the thigh of the patient. Or in a bed bound patient, you can keep it hanging by the side of the bed. We'll talk about removal of the catheter as well. And remember that when you are inserting the catheter also, don't infiltrate the balloon with the normal saline or something, because normal saline will crystallize after some time and the bulb will not deflate. So removal will be very difficult. Therefore, make sure you instill only the sterile water for injection. So for the removal, of course, again you clean the penis and drape the patient and make sure that your needed function is fulfilled and the patient is comfortable. And once you decide to remove the catheter, take another 10 cc syringe with the nozzle and deflate the bulb. You have already instilled about 10 ml, so make sure that bulb is deflated. And hold the penis and slowly withdraw. If you feel any resistance, make sure that you have 100% deflated the bulb. Slowly remove the catheter and observe the tip. Make sure that there is no bleeding as such. And also here also again make sure that you have replaced the foreskin to avoid any paraphimosis happening in the future.